This lady came in to see me. She had some concerns about just the general condition of her teeth, and also about the way her teeth, front teeth, looked. She was concerned about the color and also about the spacing. We took care of her dental problems, and then decided to proceed with correcting some of her concerns with the front teeth, demonstrating her different ways we could take care of them, and showing them to her. And we finally decided on doing some porcelain veneers. So we did place porcelain veneers on the front 6 teeth, along with some bleaching, and just got a beautiful result. Patient was just thrilled. Had tears in her eyes when we finished. I saw her just recently, and she just can't thank me enough. This gentleman came in to see me. He had some discomfort in his upper teeth, and just didn't feel like he could chew very well. After evaluating him and talking to him, we decided to restore or make the upper teeth stronger, as well as replace some of the missing teeth he had. So when we were done, all of his upper teeth were taken care of, and not only did he have a very functional result, but he was much happier with the way they looked. This gentleman has been a long-time patient, and over the years he has worn his teeth quite a bit in the front. He's had work in different areas over the time that he had been a patient. But his complaint really was that he didn't have a definite bite. And so we tried some various things out in his mouth that he could test out, and he felt much more comfortable with those things. So what we ended up was restoring his mouth, and what I mean by that is to go ahead and build back what he once had. We did that with a combination of crowns and veneers, and he loved the end result, not only because he now had a definite bite, but that it just looked much better. We were able to give him the color and shape of the teeth that he ultimately wanted. This young lady came to me because of an accident she had. She was actually kicked in the mouth by a horse, and she lost several teeth on the upper left side. So after rebuilding some of the bone in that area that she had lost, we went ahead and had 3 implants placed, and we went ahead and restored that area then with 3 crowns over those implants. Along with that, she did have some orthodontics or braces done, and we got what was a very nice result. This lady had some old crowns on the 4 front teeth that had been done many years ago, and she asked me if anything could be done to improve them, and of course there was, and that was to replace those 4 front crowns. And then we did 2 additional crowns, so those front 6 teeth would all match and blend in with her other teeth. And now she's able to smile and feel really good about it. This lady has been a patient of mine for years, and she has had severe wear on her upper and lower teeth. She also had a couple teeth replaced in the upper arch. She really didn't want to do much for a long time because she was concerned that anything that we would do in terms of crowns wouldn't be natural looking. But we finally convinced her and showed her that we could do some natural-looking things, showing her some other cases that we had done. And so we did end up restoring those 6 upper front teeth with crowns, or 2 bridges, I'm sorry, and we made them as natural looking as we could, and she was very pleased.
This patient presented to our office because she was unhappy with the color of her front 2 crowns. According to her, she really hadn't noticed it until her nephew asked her what was wrong with them. So she presented to us, and then in our conversations we discussed whitening first, so we would have a brighter shade to match. So the procedure was, we did some at-home whitening trays, some custom trays. Once the desired shade was where we wanted, we prepared both those old crowns for new crowns. The patient went to our laboratory for custom shading, so we could match them as lifelike as possible, and then, as you can see, we ended up with a beautiful result. This patient presents to our office not because he wanted to fix his teeth, but because his wife was not happy with his smile. So what we did for this gentleman was a combination of whitening. We did a little bit of adjusting of his bottom teeth, and then we did a combination of crowns on his front right side eye tooth and lateral incisor, and then his left side, same teeth. His front 2 teeth were not touched. We matched those with custom shading, as you can see. We also did replacement of some old silver fillings and replacement of missing teeth with a bridge on the upper left. This young lady presented to our office because she had always been very self-conscious of smiling, because she was not only unhappy with the shade of her teeth, but also the color. She was not happy with the 2 old porcelain veneers that she had on her front 2 teeth, and she also did not like the irregular shape of her gum line. So in a combination of whitening, gum contouring, and porcelain veneers, we were able to restore her mouth to a very pleasing result that she was extremely ecstatic, and basically was going around telling everybody and smiling and passing out our cards and telling them that they need to come see us. She was extremely pleased. This gentleman presented to our office due to the fact that he was unable to smile. He said he hadn't been able to smile in years, and as we can see, he had a very, what we call, patched mouth. Lots of individual work done. Was very worn down. He never felt like he was able to chew or bite his food because he felt like his bite was inconsistent. So our goal was to not only improve the function or his biting ability, but to give him a nice smile. Patient desired as white as possible. He wanted it to be quote-unquote Hollywood white. And when we were finished, the patient basically was very pleased and basically said he should have done this years ago. What we did for this gentleman was a combination of crowns, porcelain veneers, and a couple bridges. We restored his whole upper jaw and his lower jaw, and the patient was extremely happy. Okay, this gentleman presented to the office with the desire of wanting his smile to not look older than he was. He wanted to improve his smile. He said it was time. His wife wasn't sure why he was doing it, but she subsequently has had treatment done because he was so pleased with his results. And what we did for this gentleman was a combination of crowns and bridges to replace a removable partial and a little bit of whitening. We've since gone on to complete the rest of his mouth, his upper and his lower, because he was so extremely pleased with the result. This patient presented our office due to her not being happy with her porcelain veneers on her 6 front teeth. She was not only unhappy with the color, but the shape and the irregular level of her gum tissue. So what we decided to do for this patient was to whiten her back teeth, go ahead and adjust the level of her gum tissue to be nice and level, and we made her brand new porcelain veneers on her front 6 teeth. Okay. This gentleman presented to the office with the desire to have whiter teeth, wanted to whiten his teeth. And then because this patient had 4 old discolored crowns on his upper front teeth, we had explained that he needed to replace those as a combination with the treatment. So our first step was to do the whitening. Once we achieved the desired shade, we went ahead with the latest material and made 4 porcelain crowns to match the rest of his mouth, with a result that's very pleasing and very natural, and the patient was extremely happy. This patient presented with the desire to improve her smile because she hated her smile and was not happy wearing a partial anymore. So we, after analyzing her photos and her smile and her bite, we decided that the best course of treatment to improve her function and her smile and aesthetics was a combination of new crowns, implants, and bridges to our newly desired results that we came up with on our smile analysis and our bite analysis. The end result, as you can see, the patient was very, very pleased with not only the shape, not only the color, but also not having to take anything in and out of her mouth anymore because of her implants. This patient is 16 years old and just completed orthodontics. And due to a size discrepancy of her teeth, congenitally or from birth, we decided to do a conservative course of treatment where we whitened her teeth, and then we did freehand composite bonding directly in her mouth to form the teeth to a natural, pleasing shape and balances from the left to the right very nicely, and she was extremely, extremely happy. You can see that we were able to reproduce the color and the texture and the white calcification that she has on her front 2 teeth and the other teeth around her mouth. The patient was extremely happy. This patient presented to our office with the desire to be able to chew again because her teeth were loose. Aesthetics or her smile really didn't come into play until we started showing her what we could do and what was out there. She then became so involved in wanting to have a beautiful smile, because originally it was all about chewing and function, that she went on to have some adult orthodontics done on her lower teeth to straighten those out and whitening. What we did for her on the top was a combination, on her whole top arch, was a combination of crowns and implants, because she ended up losing the front 4 teeth. So we had 2 implants placed, did an implant bridge in the front, and then a combination of crowns and bridges on the right side and the left side on the top. Overall, the patient was extremely, extremely happy with a very beautiful result. Okay, this patient presented to the office with the desire to replace some old discolored composite bonding on her 2 front teeth, and also her left lateral incisor next to the front tooth. The treatment plan that we discussed and came up with was to replace the front with 4 porcelain veneers, her 4 front teeth, and a combination of whitening on the back teeth as well, resulting in a really beautiful, natural smile and color.